So basal cell carcinoma, the origin site of this cancer is the basal cell layer. It is located in the innermost layer of the epidermis directly above the dermis. It's most commonly caused by somatic mutations as a result of chronic DNA damage from UV radiation. When this UVA radiation comes in, it actually damages the backbone of the DNA, causing incorrect base pairings. So in the figure to the right at the bottom, you see a 6-to-5 base pairing, which is traditional and normal in this specific molecule. But due to UV radiation, you have a 6-4 base pairing, which is incorrect and causes damages to the backbone and leads to prolonged effects and actual mutations in the genes. There are some genetically inherited mutations that can increase the risk of basal cell carcinoma, which would then only require one somatic mutation to cause the cancer. One example of this genetically inherited mutations would be Gorlin syndrome. But for the sake of this PowerPoint, we are focusing on somatic mutations and their treatment. So the most commonly mutated gene in basal cell carcinoma is the PTCH1 gene and mutations in the SMO receptor. Under normal conditions, PTCH1 actually represses and regulates SMO because when SMO is turned on, it turns the hedgehog pathway on. So you have PTCH1, it represses and regulates SMO. When it allows SMO to turn on, SMO goes and it turns on the hedgehog pathway. Now, once this hedgehog pathway is turned on, it releases members of the GL1 protein family. These proteins are super important because when they go to the nucleus, they act as transcription factors, and they trigger cell renewal, survival, and angiogenesis. So you don't want these things turning on all the time, obviously, because of all these huge cell cancer hallmarks that they can actually lead to if unregulated. So if PITCH is mutated, it does become non-functional, which means SMO is unregulated, which means the release of GL1 proteins is also unregulated, causing movement to the nucleus rapidly and consistently and constantly, leading to constant cell growth, renewal, and angiogenesis, which is a huge hallmark of cancer, heavily aids in its pathogenesis in basal cell carcinoma. And if unchecked and untreated, whether surgically or medicinally, it can lead to the final result of a surfacing basal cell carcinoma within the patient, which often shows itself in a similar way as seen to the picture on the bottom right.
Vismodegib is an FDA-approved treatment of advanced metastatic basal cell carcinoma. It became the first agent to target the hedgehog pathway to receive FDA approval in 2012, and then it was also approved by the European Medicines Agency in 2013. It acts as a smoothing receptor inhibitor that causes GL1 and GL2 transcription factors to remain inactive. When these transcription factors are inactive, they can no longer be released to trigger transcription of genes involved in cell renewal, fate, and survival, as well as angiogenesis. And adult patients with symptomatic basal cell carcinoma or locally advanced basal cell carcinoma that are inappropriate for surgery or radiotherapy are eligible to take this drug, and the amount that the patients receive depend on many conditions that have to do with the tumor. The drug is currently undergoing trials to treat metastatic colorectal cancer, small lung cell cancer, stomach cancer, pancreatic cancer, medulloblastoma, and chondrosarcoma. So basal cell carcinoma is associated with inappropriate expression of the hedgehog signaling pathway. And the hedgehog signaling pathway activation is caused by an overexpression of hedgehog ligands. This has also been observed in other tumor types, including ones originating in the pancreas, colon, prostate, and ovarian carcinomas. As mentioned earlier, the mutations of the PTCH1 protein is what drives the spread of basal cell carcinoma. When this protein has a loss of function mutation, it can no longer inhibit SMO signaling, and the hedgehog pathway is activated, causing the GL1 proteins to be released to the nucleus. Then the GL1 protein acts as a transcription factor, and it triggers cell renewal, survival, and angiogenesis. So here's a picture of how the drug works. So when the hedgehog signaling ligand is present and binds to the protein PTCH1, SMO is no longer inhibited, so the transcription factor GL1 enters the nucleus, and then it stimulates cell division and tumorigenesis. In this picture, this drug is another receptor targeting molecule, and it works similar to vismodegib, and they both bind to SMO, and they inhibit the hedgehog signaling pathway to be reactivated. When the hedgehog signaling pathway is inhibited, GL1 proteins can no longer be released, so the cells are unable to undergo their unregulated cell growth, renewal, and angiogenesis.
According to cancer.org, roughly 5.4 million cases of basal and squamous skin cancers are diagnosed each year in the US. 8 out of 10 of these are basal cell cancers. And although death is uncommon at around 2,000 per year in the US, the incidence of basal cell carcinoma has been rising throughout the past decade. Of the 7,814 cases of skin cancer in individuals younger than 30 recorded by the SEER database from 2000 to 2008, only 0.008% were basal cell carcinoma. In 2019, there were 4 million cases of basal cell carcinoma in the world, and of these cases, men had a higher age standardized rate of skin cancer than women. Global age-specific rates were higher in older adults, which increased from 55 years of age. Raw data and age standardized rates of skin cancers varied in different countries. The highest incidence was in high sociodemographic index regions. There was an increase in incidence observed from 1990 to 2019 in East Asia and Sub-Saharan Africa. There was a slight decrease in age standardized mortality and age standardized disability adjusted life years from 1990 to 2019. And there was an increase in age standardized rates of basal cell carcinoma across the globe. The graph on the left shows the age-specific rate of global incidence for basal cell carcinoma in 2019 as observed by Zhang et al. In 2021. And on the right, we have the global distribution of age standardized rates of basal cell carcinoma incidence, disability adjusted life years, and mortality for both sexes in 2019, also observed by Zhang et al. In 2021. The risk of developing basal cell carcinoma increases with age, likely due to the buildup of sun exposure over time. People with light-colored skin are more likely to develop basal cell carcinoma due to having a lower amount of melanin, which protects the skin from UV rays. Those with freckles, naturally light hair and/or eyes, or who burn easily are at an especially high risk of developing basal cell carcinoma. Ultraviolet light exposure from sunlight or tanning beds damages the DNA inside skin cells, and when the genes controlling the proliferation of skin cells are damaged, basal cell carcinoma can arise. This is believed to be the most causative risk factor. Those who have undergone radiation chemotherapy are more likely to develop basal cell carcinoma because radiation therapy damages cellular DNA, making it more likely for cancer-causing mutations to occur. People who have had basal cell carcinoma in the past have a much higher risk of developing another one, and those suffering from certain conditions or weakened immune systems, such as Gorlin syndrome, xeroderma pigmentosum, and HIV are at an increased risk for developing cancers such as basal cell carcinoma. A 37-year Dutch observational study conducted by Flohill et al. In 2013 gathered data from the Eindhoven Cancer Registry to find trends in basal cell carcinomas by age, sex, and site in the Southeast Netherlands from 1973 to 2019. The cumulative risk for developing basal cell carcinoma before the age of 40 was higher in women than in men. The lifetime risk for men was 21% compared to 18% for women, and carcinomas were mostly found on the head and neck region, which are areas often exposed to the sun unprotected. The cases were believed to be caused by intensive UV exposure, such as from sunlight or tanning beds. The results indicated that stronger legislation regarding tanning bed use was necessary, for example, setting the legal age for use at 18 years old. The results also indicated that more measures were needed to be taken to encourage people to wear sun protection. This led to the implication that better sun protection equals less basal cell carcinoma cases. Vismodegib is a hedgehog pathway inhibitor that can be used to treat advanced or recurrent basal cell carcinoma. It has been shown to help shrink tumors in some people, but it's unknown whether mortality decreases or not. Vismodegib should not be taken by women who are pregnant or may become pregnant because the hedgehog pathway is important for embryonic development. Adverse effects include muscle spasms, joint pain, hair loss, fatigue, problems with taste, poor appetite, weight loss, vomiting and nausea, itchy skin, diarrhea, constipation, and loss of menstruation in women. A double-blind phase 2 trial conducted by Drino et al. In 2017 gathered adult patients with multiple basal cell carcinomas. 116 were randomly assigned to treatment group A, and 113 were randomly assigned to treatment group B. The primary endpoint was percentage reduction from baseline in the number of basal cell carcinomas, and the primary analysis was intention to treat. The mean number of basal cell carcinomas reduced by 62.7% in treatment group A and 54% in treatment group B. 216 of the 227 patients experienced at least one adverse effect. The most common grade 3 or worse side effect were muscle spasms, increased blood creatine phosphokinase, and hypophosphatemia. Serious treatment emergent events were noted in 22 patients in treatment group A and 19 patients in treatment group B. 4 patients died from adverse effects, but only 1 death was possibly related to treatment, which was a pulmonary embolism in treatment group A. Both dosing schedules showed promising results to treat basal cell carcinoma, though further studies are necessary. The graph on the left shows the reduction in basal cell carcinomas across 73 weeks of treatment. And on the right is the most commonly reported adverse effects among both treatment groups. The Genentech set price for vismodegib is $7,500 for a month's supply, or around $250 per capsule. The duration of treatment varies, but the average time is around 10 months, which means the total cost would be $75,000. Vismodegib is only available through specialty pharmacies, and it's very expensive without insurance, but also very effective in treating basal cell carcinomas. It's covered by many insurances, but many have a hefty copay. For example, it's covered by Medicare, but the copay values vary by state and can be anywhere from $92 to $448 for a month's supply. Overall pros include assistance from insurance, and on average, you only need to take the medicine for less than a year. But on the other hand, it's still unaffordable for many, both with and without insurance, due to hefty copays.
Most common subtypes of basal cell carcinoma are nodular, micronodular, superficial, morpheaform, infiltrative, and basal cell carcinoma with squamous differentiation. And it's broken up into different stages based on how the size of the tumor is scaled and how deep the skin it is, and whether the cancer has spread into lymph nodes beyond the tumor. And it's staged on a 0 to 4 scale. And the more aggressive subtypes are micronodular, infiltrative, morpheaform, and squamous differentiation. And superficial and nodular subtypes behave with non-malignant behaviors. Most basal cell carcinomas are stage 0 or 1, and stages 3 and 4 are very rare. Basal cell carcinoma rarely metastasizes, but if it does, then the mortality rate is higher. And obviously, there are different treatment indications for different tumors. Surgery and incision is the first choice treatment for most tumors, and Mohs surgery is also effective at treating certain tumors. But this is a more complex and time-consuming process, and I kind of put a picture over here that kind of explains what patients can expect during Mohs surgery. But when basal cell carcinoma does spread, this is when targeted drugs like vismodegib are considered for patients. But optimal management of basal cell carcinoma can be facilitated by early recognition and priority treatments given to the aggressive subtypes. So the clinical course of the disease, it first appears as a change in the skin, such as a growth or sore that won't heal, and they often appear as shiny skin-colored bumps that are translucent, but they can also look like brown, black, or blue lesions, flat or scaly patches, and white, waxy scar-like lesions. And these can have a raised translucent border, or they can grow quite large, or they can have a clearly defined border. And these most often occur on areas of the skin that are most exposed to the sun, like the head and the neck. And here's a picture over here that shows warning signs of basal cell carcinoma and what it looks like on skin. So the treatment protocol, the drug is given by mouth, and patients are instructed to swallow each capsule whole with or without food. It's important that patients don't crush, chew, or split the tablets. And if a patient misses a dose, they should take it as soon as possible. If it's almost time for the next dose, they should skip the missed dose, though, because it's important that they don't double dose. And patients should perform hand hygiene before and after taking it. And drugs taken for heartburn and stomach problems can cause adverse reactions when taken with vismodegib. So patients should consult with their physician before taking these together. And it should be stored at room temperature in its original container, away from children and pets. Some of the side effects that patients can experience include hair loss, constipation, nausea, vomiting, loss of appetite, muscle spasms, weight loss, fatigue, and diarrhea. But there are medications that can be given to patients to reduce the side effects that they experience. But for sexual health and fertility, it's important for women who are sexually active to use birth control while taking this drug and for at least 7 months after they finish it, because it can be very harmful to unborn babies.
So moving on to drug resistance, there are certain mutations that interfere with the binding of vismodegib. 20% of patients on vismodegib experience some level of drug resistance. Now, 90% of sporadic basal cell carcinomas have PTCH1 mutations, while only 10% have SMO or smoothened mutations. However, 50% of patients who experience resistance had smoothened mutations. So switching or combining therapies is the best course of action for patients who have resistant tumors. Now, some of these drug combinations are thought to improve clinical outcomes. One of these is photodynamic therapy, which involves drugs that are actually activated by light, which is pretty cool. It's also thought that vismodegib and intraconazole can be used together. And intraconazole is typically used as an antifungal agent. So patients who received vismodegib fewer times a week compared to normal treatment combined with daily intraconazole showed complete pathologic responses. Now, these were only individual patients and not any wide-scale studies, but it definitely needs to be researched more because it does seem pretty promising. So this is one individual who only received vismodegib one time a week, which could really alleviate some of the adverse side effects. Picture A is his tumor before beginning treatment. B is 4 weeks into treatment. C is 12 weeks, and D is 16 months. So a really big improvement. And it's thought that these two drugs work so well because they bind to different sites on smoothened, which allows them to work together rather than competing with each other. Now, to fully understand how and why vismodegib was developed, it's important to understand how the hedgehog pathway works. So PTCH1 inhibits smoothened when ligands like sonic hedgehog are not present, and the inactivation of smoothened initiates GLI2 and GLI3 proteins to be truncated into GLI2R and GLI3R forms. And these are repressor forms, so when they translocate into the nucleus, they inhibit the activation of GLI target genes. Now, when ligands like sonic hedgehog are present, it inhibits PTCH1 from inhibiting smoothened. And after that, PTCH1 gets moved into the cell and actually gets destroyed. And then smoothened gets phosphorylated and it moves up into the plasma membrane, which stops GLI2 and GLI3 from being truncated. So when they translocate into the nucleus, they are able to bind to the DNA and express GLI target genes, which then leads to cell proliferation. And in this process, PTCH1 is reproduced. So when there is a mutation in PTCH1, the tumor suppressor gene fails and it can complete this cascade time after time after time in a row. So the development of vismodegib occurred after an overactivation of the hedgehog pathway was observed in laboratory mice. And it was pieced together that there is a steroidal alkaloid called cyclopamine that inhibits the hedgehog pathway in vertebrates. And this chemical was discovered when sheep began having deformed offspring. And they realized that it was because they were consuming a plant called the corn lily, which naturally contains cyclopamine, and cyclopamine binds to smoothened and inhibits it, basically replacing PTCH. And vismodegib was developed as a functional analog to cyclopamine. And it was first developed to treat medulloblastomas, which is the most common form of brain cancer in children. Now, vismodegib is highly specific to smoothened, but this means that it can also affect smoothened in non-cancerous cells. And obviously, this is a big problem in development, as we learned from the sheep having deformed offspring, because the hedgehog pathway is involved in almost all organogenesis in animals. But in adults, the hedgehog pathway is involved in things like normal tissue maintenance, which can lead to some of the side effects you may experience on this drug. And one example of this is dysgeusia, which is an alteration in taste. And this was discovered in a study by Yang H. et al. That found that vismodegib reduced the size of taste buds in mice. And they realized this when mice given vismodegib reacted to food stimuli differently than mice in the placebo group. And they realized that because the hedgehog pathway was impacted in normal cells, the taste buds weren't regenerating at the speed that they should have, which impacted their taste. And these are our sources.